To be honest, myself and my team, we did not know that things were this bad. Where we warned up a collapse, we didn't know that the system was actually collapsing in front of our very eyes. The latest storm or hurricane to hit the healthcare sector is the mold crisis at the Kingston Public Hospital. Now, as far back as last year, October, November, there were concerns about mold in the clinics. A study was done, and because of the JLP's response every time we make a claim to attack us and call us liars and purveyors of misinformation, we are making the reports publicly available so that Jamaicans can see for themselves that an independent subject matter expert has confirmed that there is a mold crisis at the Kingston Public Hospital. They have moved out the clinics from that area, downscaled the size of the clinics and house them in a separate room. But the problem still exists. The pitch patch work that took place at Cornwall Regional Hospital when that mold crisis first came to light about 9 years ago is the same sort of work that is taking place at KPH today. On top of that, there was a recent expose of the operating theaters not being functional because of the air conditioning units not working well. This was downplayed, but we did see that the 4 operated theaters are shut down now at the Kingston Public Hospital. And what has happened is that in that moist environment, mold is growing in the operating theaters. Again, this is being downplayed as something that can be fixed. But we know the track record looking back at what happened at Cornwall Regional Hospital, and we are very fearful that the same thing is going to happen at KPH again. We as a nation cannot afford for that to happen. We have 2 Type A hospitals serving Jamaicans in the public healthcare system. Cornwall Regional Hospital is basically non-functional. Kingston Public Hospital has been the only Type A hospital in the public sector that has been carrying the brunt of all of the trauma, all of the specialist care across the island while serving the needs of the Kingston metropolitan region. Now, with KPH being downsized, it is a crisis affecting not just Kingstonians, but Jamaicans right across the island. Surgeries have been cut, understandably, because you don't have an operating theater. There are emergency surgeries and dire emergency surgeries only. Dire emergency means that you're going to die. And so you have to rush the patient to theater. If you have an emergency and you're not going to die immediately, then you wait until you become a dire emergency. Unfortunately, there are people who are patients who are admitted at KPH now who will never make it to an operating room. They unfortunately are going to die waiting to receive service. They have tried to outsource some of the more urgent cases, cancer cases, at the University Hospital. It has been a logistical nightmare. They're not getting half as many cases as they would have liked done. They're trying to do some at Bustamante Hospital in another piecemeal approach, but there is no coordinated plan to see how you're going to get surgical services up and running. There are some crucial surgical disciplines that we cannot afford to fall off completely. One such service is neurosurgery. With Cornwall Regional Hospital not having a fully functional neurosurgical service, we're left with just KPH, and now KPH does not have a functioning neurosurgical service, which means that if anyone anywhere in Jamaica gets a fall or any head injury, they are in serious danger of dying on something that could have easily been fixed with surgery. Do not feel that the University Hospital can shoulder the brunt of all of the trauma, all of the complex cases that are currently being sent for their management. They cannot. One Type A hospital in the entire Jamaica cannot serve a population of almost 3 million persons who are getting older, who have chronic diseases and get a lot of strokes, heart attacks, And we do have a high rate of motor vehicle accidents as well as violent trauma. So when you put all of those factors together, taking out Cornwall Regional out of the public healthcare sector and now taking out KPH as well, we are in a serious crisis mode. We cannot pretend as if it is business as usual. We cannot paint up a building and say that renovations are taking place. We cannot say that this was something that was inherited. We have to take decisive actions now. Again, other services that are affected. The ICU, when we spoke about ICU spaces and ventilators, the pushback was that it was simply not true. But the evidence came out from their own audits that we were lacking ICU spaces. Now, back then, a year ago, the ICU spaces at KTH contributed at least 7 total number to the bed count. Today, we're down to about 4 because the ICUs are non-functional, so they've moved them over to the Victoria Jubilee Hospital. So when you look at the whole picture, we are seeing a non-functional type A hospital, which was the last of the two that were supposed to serve the entire island. And with KPH out, we are in serious danger. Please do not get sick. Drive carefully because you cannot be guaranteed that you will get adequate medical services. Now, there are some pictures that show the molds growth in the ceilings, and there are some pictures that show what is known as a petri dish, those round dishes that actually show the different colonies of the mold. And you can see that these are visual depictions of high levels of fungus in the areas that were swamped. And the averages are way out of what would have been expected. Patients cannot be seen and treated in these areas. There are a lot of issues that come with mold inhalation, and the staff are at serious risk. And anyone who has worked at Cornwall Regional can tell you that working in a mold-infested environment does cause respiratory problems. You just feel sick all the time, and it may aggravate some chronic diseases. So we're putting patients and staff at risk while this cover-up is going on. Remember that this was a report that was handed over to the team at the Ministry of Health from as far back as November last year. I say all of this to say simply that the current administration cannot be trusted any longer to manage the affairs of the Jamaicans and their healthcare system. The response, as Jesse had said, is that you first attack the messenger. You try to cast doubt on whether or not they are speaking the truth. And this is why we're making all of our data public. There are some data, some information that was said to be in strictest confidentiality because of the fear of victimization. But more and more people are speaking out. You attack the messenger, you attack their character, and you get your subordinates and your surrogates to do so. So on social media, you expect to have a barrage of insults, and quite frankly, I've gotten used to it now. But, I have just one thing to say to all of those persons who they're using on social media to attack those very persons who are trying to help you. They don't care about you. When I was in the public health sector at various levels, I would get a call from politicians to look after or look out for a prominent businessman or a party worker. I would never get a call to look out for a social media warrior. If you, unfortunately, are a big city of ill health and you seek services at the health center or the hospital, you will not be getting any favorable treatment because a politician is asking anybody. They don't care about you. So while you're there fighting amongst yourselves, it's allowing them to continue the rape of the system. And why I say they're raping the system, I have to bring up again, a drill was bought at the Bustamante Hospital for Children for $30 million. That drill can be sourced on the open market for $5 million. We have to ask, why is it that a government that is so concerned about taxpayer dollars is paying $30 million for a drill that can be bought for $5 million? These are the questions that we should be asking instead of fighting each other. The other thing that we have to address is the current minister's predilection towards shifting blame. It is never his fault, and it is always the fault of multiple administrations not maintaining aging infrastructure and equipment. But Mr. Minister, there's a difference between fault and responsibility. If somebody leaves a baby on my doorstep, it's not my fault, but it is my responsibility to make sure that that child is here taken care of and given over to the appropriate authorities. It may not be your fault, but it is your responsibility to fix the healthcare sector because you are the one in charge. So deflecting responsibility from addressing adequately the source of the problem in a meaningful way by saying it is not your fault, we are just no longer going to accept that, and we're going to be calling you out on that, should you try to do so in this occasion. And the other deflection is usually that blame is cast at the feet of the senior managers of the facilities. And I want to speak to all the senior managers out there, because when I'm doing my hospital tours, I'm always taken to the newly renovated sections. The bypass areas are the ones that are overcrowded. When you speak to the groundsmen, the cleaning ladies, they'll tell you the true picture of what is happening at the different health facilities. But we have this tendency to put out the potted plants and move the patients out of the corridors when you hear that a spokesperson or a minister is visiting. You need to stop that now, because what that is allowing those who continue to pillage the system to do is to make it seem as if everything is fine and they're doing a great job while things are falling apart. And then when things are obviously falling apart, they will throw you under the bus. And may I remind you of that was what exactly happened at Bustamante Hospital when it was said that it was the managers and the doctors who were trying to hold up the system who did not alert the powers that be of what was really taking place. So take sleep, mark death, and please desist from trying to aid in any cover-up and trying to make things look rosy, because it is obvious to every well-thinking Jamaican who is not blinded by political lenses that things are falling apart and they're only getting worse under this management. The question is asked, where is the minister at this time? Not sure where he is currently, but we do know that Jamaicans will be presented with a $3.3 million plane ticket bill for the trips. The April Fool joke is that he left Jamaica economy class and he's coming back to Jamaica via economy class, but then all other legs are business class, amounting to over $3.3 million at a time when we still have mothers crying for their children to be able to get a CT scan after a motor vehicle accident. Priorities, my fellow Jamaicans. Priorities. And with that, I close off. And I wish you all the best, because as I had mentioned before, we are in a crisis and there's no guarantee that you can get adequate medical care at any hospital, because if they have to transfer you to KPH, it is a problem. God go with you all.
Hi, good morning. My name is Shauna Small. I'm a reporter at Casino. I have a question for you. Jesse, as it relates to the graph that you showed, that exposed, that showed the contamination in our water, the 5% in the international area, is that figure representative of all concerns that I do are specific to a particular plant, water treatment plant. And if you could, you're saying essentially the water we're drinking is unsafe. If you could, can you explain to us, what are some of the risks in drinking water with chloroform?
All right. Thank you for your question. So, just if I don't know if you're able to project the chart. So the chart is being projected again. So what we're saying, as you see the bars, the purple bar that indicates for at the source, that's where the water treatment is taking place. So after I've treated the water, they test the water to see if the treatment has worked. And the yellow bar is in distribution, that means at the pipes. So what we are saying is that in Kingston and St. Andrew, in some sections, especially your rural areas, so for example, persons who are served from the Griffin Water Treatment Plant, Susie Spring, Bilboa, Bowden, those areas, and there are other water treatment plants in rural areas that are affected, they will be getting this, they would have been getting this contaminated water. Now the NWC, in their admission, after they admitted finally that they were having challenges, they have said that they have done flushing of the lines and so on to make the water safe for consumption for these residents. However, based on my visit to some of these sites, I know that more needs to be done in order for you not to have these results, to get these results back into the normal range. So that 5% coliforms you see running across the line going across, that's the standard. So anything above that is where you're having issues, and you can see for the rural areas it's significantly above. And for your distribution for Kingston and St. Andrew, meaning urban centers, it's right at the borderline. So you asked about the coliforms. So the coliforms, these are organisms that are present in the intestines of warm-blooded animals, and also they're found in soil. So they are used as an indication of the quality of your water. So if you're having high levels of coliforms, so these are bacteria or germs in the water, having high levels, it means that your treatment isn't working or your water supply is contaminated. So something is happening along the line that is causing these high numbers. As you can see at source, for some of your rural treatment plants, they are at 23 when the allowable limit is 5. So what you could have happening is persons being exposed. So when they have high levels of coliform, it don't only mean that it's only coliforms present in the water, but they are indicator organisms. It means that you could have viruses in the water too as well, parasites in the water too as well. And as you know, parasites can damage the organs, they can damage the intestines. Viruses can cause diarrhea, vomiting, illnesses like that. What you have happening, what has been saving us for the most part, especially persons in the rural areas, is that a lot of persons who can afford it, they buy water. That is part of the thing that has been happening. But it's not, that doesn't guarantee your safety. Because when you have contaminated water in one area, you do not know where that water will end up. Because why I'm saying that is that people catch that water and then transport it to other areas. They use it for cooking in other areas. And when you buy water from water trucks, some of them, they go to these rural areas that are not as heavily monitored to get the water from the line. And then they come and sell it to different areas, even some water shops too as well. So what you have happening, once you have them putting out water that is not safe, that don't meet their own standards, it means that you are putting the entire population at risk. And sometimes when people get sick, they don't believe that it's probably coming from the water. They probably attribute it to other source because they're expecting high quality water that should be coming from the pipe. But what we are saying is that if your own results are showing that it's not meeting the standards, you need to do something to not expose the public to this.
I have a question as well for Dr. Dawes. Dr. Dawes, the report that you cited was done last year. I've spoken to the administration PPH and they said that since that assessment was done, steps were taken to address all of those areas that you highlighted, the large areas and so forth. Are you disputing this?
Anybody can say that they're taking steps. Well, what sort of steps? If they're definitive steps, then there shouldn't be any problem at all for the clinics to be moved back into the areas that they have taken steps to address. They can't. The clinics are held in another area, and they have partitions and less rooms than before because it is still not rectified. And this is the same thing I was speaking about before. The administrations of the institutions need to stop covering up for the policymakers at the Ministry of Health. If they continue to do so, then they're going to be thrown under the bus and we'll never solve the problems. So to make a vague statement like steps were taken, it is not telling the truth. It is specious. It may seem like they were addressing it, but it is not being addressed. It has not adequately been addressed. And if we continue along this path, we're going to get Cornwall 2.0.
Thank you. We recognize Jason Cross online from the Jamaica Observer. Please unmute and go ahead with your question.
Hi, morning everyone. I'm Nikita. Dr. Dawes, over what period did those overseas trips happen?
What are currently taking place?
That you have. Where did the minister go?
Well, from now on, I've made a commitment not to share or say anything publicly without having my receipts. And I literally have my receipts right here, and we can make them the redacted itinerary available to the public. That shows that the business class tickets, they are over $3.3 million, with the only economy legs in and out of Jamaica. So that can be made available for your perusal. As to why he's there and why he's traveling, that can be ascertained from the Ministry of Health.
Do you have a follow-up, Jason? Another question for you, Dr. Dawes. Are you satisfied with the government's response with the Cuban doctors and their relationship with Jamaica?
Again, it was a nebulous response, and we are still left with no clear answer as to what is happening. So it has been the norm for several outgoing prime ministers in the Caribbean to speak definitively on where they stand with respect to the Cuban medical program. I think it's only fitting that our own outgoing prime minister speaks about it definitively.
Another question here says, any update on the billions of dollars unaccounted for at the Ministry of Health?
Well, they have a deadline. I believe it's either, I think it's May. I don't know where they are with respect to that. Again, the response was that it spans administrations not accepting any fault or responsibility, to say that, after 9 years you could have caught up with what the other administration left and not add to that backlog. But it's the modus operandi that we have to deal with. We just hope that we can get some fulsome answers, because there are some serious questions that need to be asked about the spending of taxpayer dollars at the Ministry of Health. And I think nothing short of a fulsome audit of some projects would be warranted when we assume office.
There's a question for Councillor Jesse James. What's your message to residents of Kingston and St. Andrew? Should they be drinking water from their pipes today?
Right, so my message based on the response from until NWC comes out and share the results, and also tell us the infrastructure work that was done to improve the water treatment process in a lot of these facilities. They should definitely, I recommend they should always boil water before they drink it, and I know a lot of persons use household filters. Those are also helpful to as well to get some of the contaminants out of the pipe. And you see the evidence too, when you're changing those filters, you see what is left back in them too as well. So, and wherever you are, not only Kingston and St. Andrew, but on the island, and you're getting any indications of poor water quality, to report it. And we want all the municipalities across the island to pay attention to the reports that are coming in from both NWC and the Ministry of Health, and to question where these samples were taken and when they were taken.
Yeah, just one other thing that I didn't touch on. Cancer care. We are facing a cancer crisis. At We are currently facing a cancer crisis. If you look at the Kingston Public Hospital that does a lot of the cancers, because they cannot get CAT scans and MRIs to properly stage the diseases and work up patients, even get proper investigations like colonoscopies to diagnose the cancers at an earlier stage, we're seeing far more advanced cancers being presented and the outcomes are a lot worse. Since they stopped the outsourcing of diagnostic equipment, the government stopped paying for it, a lot of people who cannot afford these diagnostic equipment simply cannot get them. And so they have to wait for inordinately long periods of time to come up with the funds before they can get these scans, and that delays definitive treatment. It simply means that if you are poor and cannot afford to pay for private diagnostics right now, you are far worse than somebody who can call in a favor or find the money to pay for such diagnostics. It has reached even the point where simple hernias, we're not operating on simple hernias, we're operating on hernias when they get complicated and present as an emergency. This is just showing you how bad things are, because these are the conditions that, if treated in a timely manner, would never get to the stage where there are an emergency. But we are facing a cancer crisis in Jamaica, and the numbers are telling us the true picture.
Thank you very much, Dr. Dawes and Councillor Jesse James. Jason Cross asked earlier, where is the Minister of Health at this time? And as Dr. Dawes outlined to you, we have a copy of his particulars. It's not our practice to make these public, but we believe in transparency and accountability, and we know the Minister of Public Relations, the Minister of Public Health and Wellness, Mr. Tufton, will come to the public with his own spin on this. What has been brought to our attention is that he's somewhere in Asia, somewhere in India, Dubai, Manila, Hong Kong, Delhi, New York, somewhere along that trip. Doing what? We don't know. Could it be that he's searching for replacements for the Cuban doctors who've served Jamaica well over the multiple years? Could it be that he's on a personal trip? We are not sure. We also do not know if it is a taxpayer that is paying for this $3.3 million trip, but we hope that when he gets back home safely, he will alert the country as to the nature of his trip. What we've heard here today confirms what Jamaica already knows. Our healthcare system is stretched to a breaking point, and the government is not moving apace with urgency or the focus that the moment requires. With operating rooms shut, wards compromised, and basic medical tools out of reach, can we honestly say that an expensive trip overseas right now should be the priority of the minister and the leadership at the Ministry of Health? These are questions of priorities, of leadership and responsibility to the Jamaican people. The People's National Party is demanding more than just acknowledgement. We're demanding action. Immediate remediation at the KPH, independent testing, and full transparency around hospital safety. We want strengthened systems to ensure our water supply meets acceptable standards. Is that too much to ask for? And clear accountability from the Ministry of Health on how funds are being spent. This is about the people. It's about ensuring that every Jamaican, regardless of status, has access to safe water, decent health care, and leaders who put Jamaicans first. This has been a press conference from the People's National Party, and we will continue to hold this government accountable, even if we have to drag them there. Do enjoy the rest of your day.